This is my week 4 GI video assessment. I'm going to be assessing my patient with an NG tube. My patient came in complaining of sudden onset of mid-epigastric pain, so I'm going to assess him, and he already has an NG tube placed, and so I'm just going to check that as well. So I would wash my hands first, check my patient identifiers, ask about any allergies, and then I would ask about different kinds of pain. I would assess the vital signs. Again, I don't have any equipment for that, but I would assess respiratory temp, blood pressure, heart rate. So then I would go into my focus. So then I'd go into like history. Patient says that he drinks 5 beers a night for the last 20 years. He's a smoker. I asked if he what kind of medications he takes, including over-the-counter meds. My patient said that he takes ibuprofen 4 times a day because he has arthritis. So he takes a lot of ibuprofen, 800 milligrams 4 times. Takes a lot of ibuprofen a day to help that joint pain. Let's see. Yeah, so I'm gonna come in and assess. So first, when I would do my focused GI assessment, I would inspect the abdomen. It looks distended. I can see bruising around the umbilicus, indicating colon sign. Has pain in the upper left quadrant, so when I auscultate and palpate, I'm going to do that last. Have them supine, so I'm going to lay them flat, and then I would turn off the low intermittent suction for the NG tube. So I would look for symmetry, make sure, like I said, I can see that abdomen distension. So then I would, after looking, we'll take a listen, and I would start in the lower right quadrant, and then skip the upper left quadrant. So I'd listen here for about like 5 to 20 seconds, see if I can hear anything or bowel sounds. Go up to the right quadrant. Listen. Okay. And so you'll hear normal vowel sounds. So then I would wash my hands again, and then I would just lightly palpate using just my fingertips. And I would skip the left upper, go down to the left lower, and then feel around. Said, ooh, ow, painful. So I'm gonna stop touching. I'll lay him back up. I would ask about bowel patterns when I'm doing my focus assessment, usual bowel patterns, if anything's changed. Would also ask about like urinary patterns too, look for urinary retention. So I'd go into the NG tube, and I would already have, like, if it was just placed, I would make sure it's correctly placed with an x-ray to confirm placement. But then also, now that he's had the NG tube, I would make sure there's a marking on the end of the tube so I know that if it's been moved out or if it's in, so I know that correct placement. And that's placed from the earlobe to the tip of the nose and then down to the xiphoid process. NG tube's here to decompress the stomach because of this pancreatitis that he's dealing with. We want to give the bowels a break and to stop the stomach from having the pancreas secrete any of those enzymes or start working very hard, so we're giving everything a break. I would watch out for complications, including fluid volume deficit. Watch out for complications using, or for pulmonary complications, to make sure they're sitting up and have a patent airway. And I would also look for any irritation from the tube, especially because it's an NG tube, it'll be through the nares, and so I have to watch out for any skin breakdown there. there's any pulmonary complications, I would assess for, or I would be able to administer Reglan. And then for any fluid volume deficit, I'd make sure that he has oral, or not oral, IV fluids going, just to prevent dehydration, as well as always assessing the oral mucosa so nothing gets too dried out. For care of the NG tube, make sure that I flush every 4 to 6 hours, irrigate, and make sure that it's patent still by flushing. And then check to see no meds can go down the NG tube, such as enteric-coated medications. Yeah, and just keep him NPO. We'd have TPN or enteral feedings going to make sure I check glucose. And then, yeah, just keep him NPO. So, that's it.